Greetings. My name is Cheryl Wissa, and I'm the National Diabetes Initiative Chair for the Student National Pharmaceutical Association, also known as SNAPA, and I would like to welcome you to Part 4 of the Life is Sweet, Savor It, Patient-Centered Mini Lecture Series. This mini lecture will cover old diabetes medication options. A few words about SNAPA. SNAPA is an educational service organization of pharmacy students whose purpose is to plan, organize, coordinate, and execute programs geared towards the improvement of the health, educational, and social environment of the community. We are dedicated to the pharmacy profession and serving the underserved. Now a few words about our guest speaker. Dr. Lori Armistead is currently a postgraduate Year 1 ambulatory care resident at the University of North Carolina Medical Center and Clinics. She received her PharmD from the University of North Carolina Eshelman School of Pharmacy in 2015 and a master's degree in chemistry from UNC in 1998. Her career interests include providing ambulatory care pharmacy services to underserved populations, specifically in internal medicine and primary care. Without further ado, Dr. Lori Armistead.
Welcome. My name is Lori Armistead, and I am currently a pharmacy resident in ambulatory care at the University of North Carolina Medical Center and Clinics. In this two-part lecture, I'm going to walk you through the different medication options, both old and new, that currently exist for the treatment of diabetes. I have no conflicts of interest to disclose related to this topic. In this first of two parts, I am going to discuss the different flavors, as it were, of older diabetes medications. For the purpose of this talk, I have arbitrarily defined older medications to be those that have been around for more than 20 years. Now, before I begin talking about all the different medications out there, I would like to lay some groundwork by first explaining what diabetes is, how diabetes medications work, and how different types of diabetes are treated differently. We will then dive into discussing some of the older diabetes medications that are currently in use. First, let's review what diabetes as a disease actually is. Whenever we eat food, whether it's carbohydrates, fats, or sugars, our body breaks that food down into glucose, otherwise known as sugar. That glucose, or sugar, ends up in our bloodstream, which in general is very good. Our brain needs glucose to work properly, and all our cells and tissues, including muscles, need glucose for energy. So the right amount of glucose in our bloodstream is good to have. We need it to live. However, if we end up with more glucose than we need at a given point in time, then the body has a way of storing it away to save for later. Our body can store the extra glucose in our livers, our kidneys, fat tissue, and other cells. Having some stored glucose on hand is good for our bodies because when we have periods of fasting or not eating enough, our body will release glucose from storage so that our brain and other cells have the glucose they need in order to function. Glucose in our bloodstream also sends a special signal to our pancreas, telling it to make and release a chemical called insulin. Now, insulin is very important for this whole process to work well. Insulin helps take glucose into cells appropriately and make sure glucose is stored away in all the right places. Without insulin, the whole system would become unbalanced and we would end up with way too much glucose or sugar in our blood. Now, type 1 diabetes is a disease where, for some reason, your body attacks and kills cells in your pancreas. Your pancreas then cannot make the insulin your body needs, and glucose is therefore not used or stored appropriately. Type 2 diabetes is a little different. Your pancreas still makes insulin, but the cells throughout your body begin to become resistant to insulin. Insulin simply does not have the effect it used to have, and glucose is no longer used or stored efficiently. The pancreas has to work harder to produce more insulin to do its job, but eventually the pancreas can give out and not be able to make enough insulin, and making the disease worse. Unlike type 1 diabetes, type 2 diabetes typically develops later in life once the body's resistance to insulin develops. The end result of both type 1 and type 2 diabetes is that you end up with lots of extra sugar or glucose in your body, over long periods of time. Your body simply can't process the sugar and glucose appropriately anymore. Having extra glucose in the blood, especially over weeks and months and years, can lead to lots of other health problems, and that is why we worry about it. Over time, this extra glucose in your blood can damage your eyes, your heart, your kidneys, and your nerves. Many people with poorly controlled diabetes over time can develop heart disease, kidney disease, blindness, and nerve pain, also called neuropathy. Having high blood glucose levels can also make you more likely to develop certain infections. So, learning how to control your blood glucose levels is very important for preventing all these other issues and living a long, healthy life. So, now that we understand what diabetes is, let's explore how different diabetes medications work. Some medications affect how your body absorbs glucose from the food you eat. They simply help limit the glucose your body is taking in. Other medications block some of the glucose your liver releases from storage, while other medications help your muscles take in and use more glucose. Other types of medications still help your pancreas release more insulin or simply replace insulin outright, which helps your body use and store glucose much, much better. And some of the newest medications that we will talk about later on help your kidneys just get rid of the extra glucose. The end result of all the medications we will talk about, though, is better glucose control, even though they accomplish it by different pathways. These medications help you get the glucose levels in your bloodstream to a healthy level. Now, I mentioned that there are two types of diabetes, type 1 and type 2. Because of how and why they each develop, we treat them somewhat differently. Type 1 diabetes is a type of autoimmune disease, a disease where your body's immune system attacks your body in some way. In the case of type 1 diabetes, your pancreas cells are the target. Since pancreas cells are destroyed by your immune system, your pancreas becomes unable to make the insulin your body needs. This disease typically develops early in life, most frequently in childhood or adolescence. Because patients with type 1 diabetes have an absolute deficiency of insulin, they simply don't make any. The only way to treat type 1 diabetes is with insulin replacement. In contrast, type 2 diabetes typically develops later in life because it takes time for the body to develop resistance to insulin. However, as type 2 diabetes progresses, the pancreas may be unable to make enough insulin, eventually requiring insulin replacement therapy as well. If you have been diagnosed with type 2 diabetes, the first step in treating or controlling your diabetes is typically to improve your diet, increase your weekly exercise, and to lose some weight. If these measures do not help control your diabetes well enough, then you may need to start on an oral or injectable medication to provide the glucose control you need. Many people end up taking more than one diabetes medication and may end up needing to take insulin as well for optimum control. Now, this slide has many of the older diabetes medications that are currently in use, and these are the ones we are now going to discuss. Perhaps you recognize some of them. Perhaps you've even tried some of them. Some of the generic names you might recognize are metformin, glipizide, and glyburide. Some of the brand names you may recognize are glucophage, Lantus, glucotrol, and Novolog. Note that brand names are typically capitalized. The first class of medications I will review for you are your insulins. All type 1 patients and many type 2 patients will become familiar with using insulin at some point in the course of their disease. All insulins are injectable medications and typically come in either vials or in pens. Some patients with type 1 diabetes may also use insulin pumps, but we won't discuss those here. Insulins that come in vials are typically cheaper, but they require one to use a syringe and needle to administer the insulin. Insulin pens, shown on the right, are much more convenient, but are often more expensive. And all insulins work just like the insulin your body makes, so it can simply be seen as replacement therapy. When you use insulin, you are simply replacing that which your body cannot make. Now, there are different types of insulin categorized by how quickly and how long they work. Rapid-acting insulins worked very quickly, last for about 3 to 4 hours, sometimes up to 5 hours, and short-acting insulins last for about 4 to 6 hours. Insulin aspart, known by its brand name Novolog, and insulin Lispro, known by its brand name Humalog, are the two types of rapid-acting insulin typically used here in the U.S. Regular insulin, as 100 units per milliliter, known by its brand names of Humulin R and Novolin R, is the short-acting insulin typically used. There is one intermediate-acting insulin, insulin NPH, also known as Humulin N and Novolin N, and it typically lasts 8 to 12 hours, depending on the dose you use. The two long-acting insulins, insulin detamir, also known as Levemir, and insulin glargine, also known as Lantus, can last up to 24 hours, providing insulin coverage all day long. The longer-acting insulins are taken either once a day at bedtime or twice a day. Because they provide all-day-long insulin coverage, maintaining an adequate baseline insulin level, they're often called basal insulins. The shorter-acting insulins are typically taken at meal times and are used to cover the peaks of blood glucose that typically occur after eating. They are often considered your bolus insulins. Some people only need to take a basal insulin. Others need to take a basal insulin plus a mealtime insulin 1 to 3 times a day to keep their blood sugars under control. Now, as with all medications, there are some pros and cons of insulin. Because insulin is a replacement therapy, it will nearly always work. You just need to find the right dose that works for you to help you keep your blood sugars low enough, but not too low. Also, because there are a variety of insulins available, your doctor should be able to design a regimen that works well for you and that is affordable. Some of the downsides of insulin is that it has a pretty high risk of causing low blood sugars or hypoglycemia. Just as having blood sugars that are too high can be dangerous, so can having blood sugars that are too low. Remember, your brain and all your cells need glucose to function appropriately. So you should always be very careful when taking insulin to not give yourself too much, to remember to check your blood glucose levels regularly, and to never skip meals, especially if you are taking mealtime, shorter-acting insulin. It really can be dangerous. Insulin, unfortunately, can also cause weight gain, which many people dislike. There is also the requirement that you have to give yourself injections 1 to 5 times a day, every day. Finally, because insulin is a protein, it must be stored in the refrigerator until opened, can only be used for about 28 days, and cannot be allowed to get too warm or it will no longer work. All in all, insulins are very effective medications and ones that many people have to use. The negative issues can all be managed well enough, though, if one is motivated. Another very commonly used medication, and one that just about every patient with type 2 diabetes has likely tried, is metformin. It is a biguanide medication and goes by the brand name of glucophage. Typically, patients take 500 to 1,000 milligrams of metformin twice a day. Unless they are taking the extended release formulation, then they take 850 to 2,250 milligrams once daily. Metformin is a medication that is taken by mouth. Now, the very first biguanide to be discovered came from the French lilac. Metformin specifically was discovered in 1922, but was not approved for use in the U.S. to treat diabetes until 1995. Since then, it has become the first choice agent for the treatment of type 2 diabetes. It works via several pathways, but most notably, it limits glucose production by the liver. Metformin is a top choice option because it is very effective and pretty cheap. A1C is a measure of your blood glucose levels over about a 3-month period. We like most people's A1C to get close to or below a value of 7. Metformin lowers A1C and thus blood glucose levels by about 1 to 2 percentage points. So if you have an elevated A1C of, say, 8.5%, metformin could potentially reduce your A1C to below 7% and be a goal. Besides insulin, metformin is one of the most effective diabetes medications we have. Unlike insulin, however, it will not cause low blood sugars or hypoglycemia and may even reduce the risk of cardiovascular or heart disease. It is a very good medication. It is also one of our cheaper diabetes medications and is not an injectable. Some negatives about metformin is that it may cause stomach upset, including diarrhea and nausea. But most people say that side effect goes away within a few weeks of taking the medication, so it's not typically a huge issue. It's also important to know that you should not take metformin if you have kidney disease. Finally, some of the available metformin tablets are quite large and may be difficult to swallow. If that is an issue for you, speak with your doctor or pharmacist to see if there is another metformin option available. Not all metformin tablets are the same size. Now finally, the oldest oral diabetes medications are the sulfonylureas, glipizide, glimepiride, and glyburide. Glipizide goes by the brand name Glucotrol, glimepiride by the brand name Amaril, and glyburide by Diabeta. Their typical doses are listed here. As I mentioned, sulfonylureas are the oldest oral diabetes medications in use. They were discovered in 1942. Unlike metformin, they work by increasing insulin production by the pancreas. Therefore, you shouldn't take a sulfonylurea with insulin or skip meals while taking one. Sulfonylureas are also quite effective and work quickly. Some clear benefits of this type of medication. They are also quite inexpensive. Well, on the other hand, they can contribute to hypoglycemia and may cause weight gain, just like insulin does. And even though they work well at first, their efficacy declines over time. They simply don't work well for very long. And finally, if you are allergic to sulfa drugs, you should avoid using sulfonylureas. Well, that wraps up our survey of older diabetes medications, those that have been in use for over 20 years. For a good overview of some of the many newer diabetes medications available, please tune in to part 2 of this lecture. Thank you very much.
All right, thank you, Dr. Armistead. And I'd just like to give a very special thank you to Walmart and Sam's Club and SNAFA, by whom this web lecture was sponsored. And once again, thank you, Dr. Armistead, for taking the time to discuss the pros and cons of old diabetes medications that are currently available on the market. Thank you to all the listeners of this web lecture. We do hope that this has been very informative and will be helpful in your everyday life and in managing your diabetes.